second and final part on our conversation about the importance of women's health. Watch it, join us in conversation, talk about it, tell everybody. Queening with the Empress, ZW. I think let's talk about what's new, what's happening in the world of health. Let's talk about my thing, about that ring. You know, I want to hear so much about that ring.
I'm very passionate about HIV, and most people who know me know is, that one who always talks about HIV. So why for me HIV and women in particular is this: we know that women are more likely to get HIV infection than men. This is due to a number of reasons, including biomedical, the fact that women have a larger surface area to receive, in heterosexual sex, especially in a context such as ours, where that's more or less what you get almost every other time. So you find that women are more likely to get HIV. Then there's also that aspect of them being able to negotiate for safer sex. So for HIV, we know condoms work, both male and female, but they need negotiation. And a lot of times, because women are not at an advantage when it comes to negotiating for condoms, you find that it's the men that takes the lead. And most men, for some reason, they don't want to use condoms, right? So it exposes the women. And then because men have multiple sexual partners, so even if she's married, she knows that he's got 3 other side women, side chicks, whichever way you call them, and she can't do anything about it. But it's because of the patriarchal nature of our society, where you're a married woman, you're not going to demand condom from a man, even though you know for a fact that last week he gave me an STI. You're not going to demand a condom from him. And sometimes, even if you do say, okay, I think you gave me an STI, it might actually turn on you, and you become a statistic of gender-based violence, where he says, I think it's you. You are the one who gave me. What makes you think I'm the one who did this STI and all that? So important is that we need a female-controlled device or female-controlled options for HIV prevention. STIs, yes, we need them. We need to be able to prevent STIs, but we know that they are treatable, right? It's easier to do that. Unlike HIV, where yes, art is very important. We have it, but it also brings with its own, challenges and all that. And then we know that when you then prevent HIV in a woman, you're also preventing HIV in an unborn child and subsequent children that she might have. So it's important to prevent HIV in women. It's important for them to have a device that they can use to prevent HIV that they can control, which then where then the Phiri ring comes in. The Phiri ring, it's a silicone ring that's just like the size, and it contains a drug called the Phiri. It's inserted inside the woman's vagina. It stays there for a month, and it slowly releases medication that prevents HIV. So the studies were done. There's been studies for about 10 years or so now. There's been follow-on studies. There's been even here in Zimbabwe, in Zambia, in Zimbabwe, Malawi, Uganda, and other countries, South Africa. We've had those studies, and it was shown that this ring is actually quite effective in preventing HIV in women. So last year, the European Medicines Authority, they approved it. They said this is something that is good, let's pursue it. And just recently, the World Health Organization recommended it as part of the basket of options that are availed to women. Like if you go for HIV test patients, they're supposed to tell you that, oh, you're negative. This means that you've got option A, which is PrEP. You can then use the ring, which is another option. They give you these options, and ring is part of it. Especially for those women who would say, my husband would beat me. Because once you insert it, he doesn't have to know. He doesn't have to feel it. It's just something that you can use. It's within your control. And you know that for that month, you are covered. But there are follow-on tests as well, maybe to include that ring to make sure that it lasts for 3 months. Then follow-on studies on if we could have a ring that does both a prevention of HIV and also contraceptives. So I'm very excited about it because this announcement by the World Health Organization was like 2-3 weeks ago, a couple of weeks ago. Yeah, so great news in terms of HIV.
When does it hit our shows? I want to sign up. Where do I sign up? Where do I sign up?
Listen, this is why I'm excited to be here, because I know you're one of the people who can hold the placard and say, ring now.
I'm the one. I'm your brand ambassador, Anna. Please don't forget me. My name is there at the top. I'm there.
Exactly. So we need advocacy. We need advocacy. We know that from World Health Organization recommendations, up to the time that it becomes part of our health, system or health response in Zimbabwe. It might take time, but if we have enough advocacy, if enough people know about it, then I hope that it will be much faster. I mean, we've done it for COVID-19. We haven't had to have vaccine go through all these other funny regulations because we know it's an emergency, and HIV is an emergency. So yeah.
You mentioned something about PrEP. There is talk of PrEP and PEP, and people tend to confuse the two. Please clarify PrEP and PEP.
The difference is in the pre and the PEP. Pre is pre-exposure prophylaxis, and pre-exposure means before you get exposed to the disease or to the virus. Now I'll give you an example of how PrEP works. If you're going to a malaria area, you take anti-malaria tablets. By the time you go to this malaria area, you are covered. You will not likely get malaria, but even if you do, it's not going to be severe. So it's before you go there. But so that's for PrEP. It's in Zimbabwe, we use a daily oral pill that you take. That's our PrEP. I know recently, of course, we've had news of a new way of PrEP, which is a long-acting injectable using a drug called cabotegravir, which is really important for me because I feel like for people who can't take PrEP every day, those who can't take a pill every day, you can get an injection 2 months. Yeah. You come back and that's it. So that's pre-exposure prophylaxis, before you get exposed to the virus. So before you have sex or unprotected sex, you take this pill. But it's taken, you take it every day. You have to take it every day, whether you're having sex on that day or not, because you need to build that immunity. But the good thing with PrEP, though, is that it's very effective. And there's been studies that have been done all over the world. Some are, in populations where they have even higher risk of HIV acquisition than heterosexual women. For example, men who have sex with men. So it's really high in terms of, efficacy. So it's a great pill. It's great to have. On the other hand, there is something called PEP. PEP is post-exposure prophylaxis. Now, supposing you were in an accident and then there was blood everywhere, you came into contact with blood that, probably was, infected with HIV and you didn't know, or you've been raped, which is sadly something that is a common occurrence in Zimbabwe. You've been raped by someone. Obviously, they would not have used a condom if they haven't. And then you feel like you could have been exposed to HIV. You get what is known as post-exposure prophylaxis. This is a medication that you take to prevent HIV after the fact. It's after already having been exposed to it. But important to note, PEP is effective if it's within 72 hours of this exposure. So you can't say I had sex last week, let me go and get PEP. No, you need 72 hours after the exposure. This is why it's important if you've been raped. If you're a victim of rape, please make sure that you visit a police station. You get, even if you feel like you don't want to press charges or you're not yet ready for those charges, there are organizations like the Adult Rape Clinic. You will get assistance. You get PrEP. You get that PEP rather. And even in hospitals, you go, you tell them your situation. Victim-friendly unit at the police stations, they're able to help you with that information. And PEP is also important even for doctors. And healthcare workers. You accidentally inject yourself with a needle from someone who's HIV positive. Yeah, that's it.
Wow. Okay. So, all right. Oh, Rachel is here, and hey, Rachel, I wanted your comment. So you could unmute in the meantime. I will just ask my question briefly. So, Umanes is asking, how often must the women living with HIV and AIDS get tested for cervical cancer? And for those living without too. So I think the question really is, how often should women get cervical cancer screening? Is it not annual?
Yeah, annual, especially for VIAC. But again, one thing we will also need to emphasize with women living with HIV, I said their risk is higher for cervical cancer, but it's different when they are on ARTs and they are undetectable, like when you are virally suppressed. We know ART works, so if you're virally suppressed, your risk becomes much lower, and it's almost maybe the same as a woman who's living without HIV. Pap smear, I would say 2 years, the older you are. VIAC, if you can be able to make it yearly, that's good. If you are a woman living with HIV and you are not yet at that stage where you are virally suppressed, I would say even 6 months is okay, because with VIAC, it's easier, it's less invasive. and it's more accessible, I guess, than pap smear.
Okay. Mkwea says, excited about the ring, Anna. Thank you so much for this great information. I'm sure most women will gladly take up the safe option. So the issue of safety comes in, and I guess also, like you're saying, it's women driven, and it's really make sure that it's just something that they have control over.
And beyond that, though, Pet, I want to say, as women, I know younger women have issues in terms of controlling and being in control of their sexuality. With patriarchy, you say women should not be forward, right? When it comes to sex, you shouldn't be the one who puts the condom on a man as a start. For starters, you shouldn't be the one who says, no, let's use this condom, because there's all these connotations about women who have sex. But I feel like we should get to a point where, in the meantime, whilst we're fighting patriarchy, as women, we should be able to say, you know what, it's my health. I'm the one who's going to be taking pills for the rest of my life, or I'm the one who's going to be facing increased risk of A, B, C, TB, and all those things. I'm the one who's going to be affected mentally if there are issues, if I'm in this health, and in this, if I have this challenge. So we need to take responsibility for that. And I know sometimes we didn't talk about, periods and menstruation, and how that is also a huge part of our health. For example, the pain that is associated with periods, we think it's normal. There's sometimes when you have a condition called, for example, dysmenorrhea, where you actually have scarring of the uterus and all those things, and it needs to be checked. You need to have treatment for it. We shouldn't take it for granted, So it's about taking responsibility for our health in spite of all these challenges that come in. And sometimes you just need to say, you know what, look, I have this issue, I have this challenge, and I need to take care of myself. I need to, take my health into my own.
That is so true, because at times we worry about everybody else. What will this one say? What will my partner say if I have condoms? If I insist on using condoms? If I buy condoms? If they find condoms at my house? What will people think when I buy condoms? Is it from the supermarket, or is it from the pharmacy? People will look at me, people will think I'm this type of person, and we forget that the alternative is worse. The alternative is worse. You would rather people look at you, but you live a long and healthy life.
Exactly. It's the same even with the issues of PrEP, right? Pre-exposure prophylaxis. There are many ways that people are getting it besides the New Start centers. There are youth drop-in centers. There are youth organizations. For example, if you're in Harare or Shitungwiza, there's Shaz Hub. I know that there's Chiedza in Blawayo. There's all these, interventions that are there. And if you say to yourself as a young people, well, if I take PrEP, like you were saying, patients that you go for an HIV test and somebody thinks, oh, okay, you did something. So it's the same thing. If I take PrEP, somebody's going to say, oh, so you are planning on having unprotected sex. But no, it's about me, right? It's about me, and it's about me taking responsibility for my health. So people will talk, whatever you do, they're going to talk, they're going to assume things about you. I mean, they assume things depending on how you're dressed. They assume things depending on which school you went to. I mean, I was just, listening to this debate about women who went to mission schools being less, I don't know, like bad manners or whatever it is that they were talking about. And it's so funny because we judge people all the time. So they're going to judge you. They're going to judge you if your boyfriend picks you up in a Lexus, or if your boyfriend picks you up in a Mazda 3. They're just going to judge. At the end of the day, it's about you and about your health.
Tatenda Nyoni, would you like to ask your question? She has a question, I think, or maybe to just join the conversation. Kindly unmute and join the conversation. Tatenda Nyoni? No, that is true. That is true. People will constantly have something to say, but I think it's important to always remember that your health and safety is number one, especially for PrEP. For me, we're living in a time where women are not safe. We are reporting so many cases of rape. So I would rather be prepared than caught unaware. So Tatenda, please join in.
Okay, I wanted to ask on the importance of gynecological health in women.
Okay. Anything in particular? Anything in particular? What is it that you would like to talk about?
Okay, how often should a woman visit a gyna and why should we visit them? I just want to know more about that issue.
Okay. Thank you so much. I think you see the issues, like I was saying before, that when it comes to women's health, there's so many things that we don't talk about. We are either we're not raised to talk about it, or it's religion, or it's culture, or whatever it is. That I know a friend of mine, a colleague, has never been to a gynae in all her life, and she does not understand why I keep pushing to get these things. Like, no, why would you go there? It's very invasive. You have to get there and open your legs, and then this. What about that? And what about this? And I'm like, you know what? I would rather go, whether it's to a sister, wherever I go, or it's a doctor or whoever, and have them make sure I am fine. If it means that they invade my territory, than to sit at home, hide my territory when it is rotting away. So I think Tatenda just wants to find out how often should women go to the gynae. I guess it's not just the gynae, but just to a health center to get tested, which is what we're talking about, the tests that women go through.
Do we know our bodies? You know, that's the first thing. You know, there are things that we don't think about, like discharge. We're brought up to think our vaginas are dirty, and discharge is something that you should be ashamed of. You should not even talk about it. You know, we don't. The first things first. Do you even know, for example, when you are going through your periods, is the discharge just before your period, during ovulation? It's different. You know, you should know your own body to the extent that you should be able to describe it, especially when it comes to reproductive health, because nobody can do that for you. Somebody can tell you that, oh, you look a little pale, maybe you don't have enough blood, or you're anemic. But with gynecological issues, it's about you. You are the one who knows what's going on with your own body. Are you feeling pain in your breast? Does this happen often? Does it happen, before your period? Does it happen during your period? Are there things that are happening there that you don't know? You should be able to know it. One of the most disheartening things for me was talking to a group of women. One of the things that I do, in terms of reproductive health, is that I talk to communities, and most of them are adolescent girls and young women. But in this particular grouping, there were older women, and I asked them, how many holes do they have down there? And most of them did not know that there's a difference between the hole that the child comes out of and the hole where your urine comes out. And this for me was shocking, because these were women who were older. And I thought you should be able to know this. And some people don't know about that. They don't know their own bodies. So to answer how often you should go to a gynae, when you see changes that are not part of something that you see normally, your discharge is suddenly a different color. You want to know what's going on. Is it a fungal infection? Is it thrush? Sometimes it's not always that. And women are scared because sometimes there's a bit of whatever is going on down there. Their first immediate thought is, oh, that's an STI. Sometimes it's not even that. You get stressed, you get fungal infection, you get thrush, all those things. It happens. It doesn't necessarily mean it's an STI. So know your own body. You should be able to tell if there are changes, like, oh, these days when I have sex a certain way, I get pain. Because that sometimes, pain after sex, it can be actually a sign of cervical cancer. Bleeding in between periods can be a sign of cervical cancer. I'm not saying that if you are having it right now, that's exactly what is going on, but no, it could, yeah, it could be. It could even be an issue of, like, for example, contraceptives. Do you know, for example, that if I take a certain contraceptive, certain things will start happening to me? It's not supposed to be normal. You're supposed to know that, oh, okay, there's something like this going on. I probably need to see a gynecologist. Now, it's just unfortunate that gynecologists are specialists. And so you find that some medical aid societies will tell you you're allowed one visit per year. Others don't even have that. They have all these things going on. If you are then using cash, In Harare, you expect to pay something like $50 United States dollars upfront for a visit to the gyno, all those things. So it's up to you. But first things first for me is know your own body. It's height. If you haven't started doing it, start checking your discharge. Know the smell. The reason why we use all these products, this vaginal steaming that I've heard, right? Just recently, the way we do all this feminine hygiene washes and whatever, we're told that we smell down there. But you know for yourself that no, this is ordinary. But now the smell is a little bit stronger, or this discharge is different. It's a different color. Or even when you visit the bathroom, you think, okay, my urine, I'm feeling a little bit of pain after peeing, or I'm peeing less or more. And you should be able to be in tune with your body, to know this, and that will guide you in terms of when to seek help. But whenever you think, okay, I don't think this is normal, okay, I don't think this is usual, please visit a doctor. Even primary health care, they'll give you some of these pointers. Some of it doesn't necessarily need a specialist. You could sometimes just go to the local clinic, It's better than just sitting and thinking, maybe it's normal.
So, Nozi says, I think there is fear around accessing cervical cancer screening during the COVID-19 pandemic. Having the equipment inserted into you, especially knowing that it's used on other women, the whole procedure is kind of an invasive one. All right. Okay. Okay. Rachel did type in and says, also, some diseases may exist without us knowing, but continuous checkups will help us to know our status. So these are young women, and this is what they're saying. Nozi, you know what? For me, when I go and I get my cervical cancer screening, I rely on the knowledge that they clean up and they try and make it safe for me. I think for me that's one of the biggest things. But I understand it is very invasive. It is. Women's bodies, most of our tests are very invasive. But I would say that we should continue making sure that we get our tests. Anna, what are your closing remarks?
Okay, so continuous knowledge seeking. Knowledge doesn't always come on a platter. I know we have challenges, like I was explaining to someone, about antibody-mediated prevention in HIV, and I was saying, trying to translate that to Kalaga, so to Ndebele, Shona even, that's just hard. But we need to seek out information as women. We need to take responsibility for our health and just be in tune, just know, just accept that, okay, I'm a woman and these are the things that I need to do and take care of it. And a big thing, mental health. Guys, mental health, I know I talk about mental health in men, but mental health for women is also very important. Please seek help. Strong woman syndrome, please, let's not do it. We need to seek help where we feel this is not good, this is not on. Let me seek help. So don't be afraid of seeking help at all.
Thank you so much, Anna. Thank you so much to my audience. Our conversation today about the importance of women's health is it's bringing me to the idea of, if we had more women sitting in positions of power, if we had more women handling the national purse, if we had more women speaking out boldly and actively participating in these decisions, women's health, access to health for women in this beautiful country of mine, Zimbabwe, would be a different story. We would not have all these things that have been raised here being an issue. I should not have to leave Bulawayo province to go to Mzingwane, which is Eskodini, which is much south, to go and get a cervical cancer screening, I think, listen, what does that say for umuntu oseflabusi who ose-avoka kogodlwayo khona ngale ehlatshwayo, who doesn't have access to all this information? Why do they have to leave their local area to access good health, which is by right, their right according to the Constitution? This is what we have signed so many documents and agreements as a country, that women and every citizen of Zimbabwe is entitled to good well-being. And like Anna said in the introduction of what health is, we should not say I am okay just because I'm not feeling sick. No, I should just be okay, and I should be able to access health without thinking about how much money I am putting forward, how much money this will cost me. At $50, give or take, for a woman to see a gynae, that's a bit pricey. That's too much. That's too much. So I go back to that. We need to have more women in these high places, women that will speak for us, women that will say in a parliament sitting, women's health matters. We need to change. We need to have our numbers drop when we're talking about maternity and neonatal. We need to do better. We need to make sure that all our hospitals, all our health centers, all our council clinics, women can go in and access, if not free, affordable healthcare. I'm not just saying everything should be free, but I'm saying it should be affordable and within reach. So to all the women that are listening today, and the men, because you are there also, and please listen, support your women, be it your sister, be it your mother, be it your partner, be it your daughter, to seek health. Egijimise ukuphila singalindi kuze kube buhlungu kakhulu kumbe uqalisa ukuvuza okunye kuqalisa ukuvuvuka lokhu kuqalisa ukuzuthini. At the first sign, please go and seek help. At the first sign, can we be done with the strong woman syndrome? Because women are dying, and that in itself is very sad. We need to do better. We need to take care of ourselves. So to all the women, stop being too strong to seek medical help. Your health is important, you are important, and you count. So please get tested. Make sure it's still early enough in the year to write down a list of all the things that you want checked out, and stay healthy, everyone. So from me today, thank you so much. Don't forget to subscribe to Site ZW right across the board on social media platforms so that you're always on the pulse with what's happening. And guys, please stay safe, sanitize, mask up, socially distance, stay home. Please, we need you around. So everyone, from me today, lots of love.